Okay.
All right. Good morning, and thank you everyone for joining today's symposium on creating maximum impact with your DSMES participant from SDOH to the use of current technology and everything in between. So today's presenters are Susan Weiner, presenting on diabetes remission and lifestyle update, what every clinician needs to know. Celia Levesque, presenting on diabetes technology in 2023. As well as Lorena Drago, presenting on Achieving Diabetes Health Equity, Evidence, Challenges, Opportunities, and Resources. So we'll begin with the diabetes remission and lifestyle update, what every clinician needs to know, and I'll pass it over to you, Susan.
Thank you so much, and a warm welcome to everyone joining today. I am so honored to be here. Let's jump right in and discuss diabetes remission and lifestyle update, what every clinician needs to know. My name is Susan Weiner, and I am a registered dietitian and certified diabetes care and education specialist. I've included my disclosures on this slide. You can review. And let's look at the objectives for today's presentation, which include defining criteria to evaluate remission in type 2 diabetes. We will discuss 3 tools, at least, even more than 3 tools and strategies for eating pattern education for people living with diabetes. We will describe the clinical impact of physical behaviors in the cardiometabolic health in people living with type 2 diabetes, as well as describe strategies to improve sleep quality for people with diabetes. Sleep is an under-discussed topic, so we will take a deep dive into that today. The American Diabetes Association, the Endocrine Society, the European Association for the Study of Diabetes, and Diabetes UK all put out a joint consensus statement on remission for people with type 2 diabetes, which says people with type 2 diabetes should be considered in remission after sustaining normal blood glucose, blood sugar levels for 3 months or more. And this is according to a joint work and statement by these organizations. So let's look at some of the criteria to evaluate and or define type 2 diabetes that was discussed and reviewed in this remission statement. A return to hemoglobin A1C to less than 6.5% that occurs spontaneously or following an intervention and that persists for at least 3 months in the absence of usual glucose-lowering pharmacotherapy, which means in the absence of usual medication-lowering therapy for blood sugar or blood glucose. When hemoglobin A1C is determined to be an unreliable marker of long-term glycemic control, fasting plasma glucose of less than 126 milligrams per deciliter, or estimated hemoglobin A1C less than 6.5 calculated from CGM continuous glucose monitoring values that can be used as an alternative criteria. Additionally, testing of hemoglobin A1C to document a remission should be performed just prior to an intervention and no sooner than 3 months after initiation of the intervention or withdrawal of any glucose-lowering pharmacotherapy or medication. And finally, subsequent testing to determine long-term maintenance of a remission should be done at least annually, every year, together with testing routinely that's recommended for potential complications of diabetes. So these are the criteria to evaluate or define type 2 diabetes remission. I know that every year we look forward to the standards of care in diabetes that is put out by the American Diabetes Association. Typically, we see it the month before the new year begins, like in December. So these were the standards of care in diabetes of 2023. And there is so much great information here. I wanted to point out some of the nutritional updates. There is no macronutrient pattern for people with diabetes, and meal plans should be individualized while keeping nutrient quality, total calorie, and metabolic goals in mind. And this is saying and builds on previous standards of care, joint consensus statements in nutrition, that one size does not fit all. All meal patterns and all meal plans should be individualized and may change over the course of a person's lifespan based on changing conditions in a person's life, medical conditions, etc. A variety of eating patterns can be considered for the management of type 2 diabetes and to prevent diabetes in individuals with prediabetes. We are always looking at the best evidence around prevention of prediabetes. By a variety of eating patterns, which we will take a deeper dive in today, this can be a low carbohydrate eating pattern, a plant-based eating pattern, for example, a Mediterranean diet eating pattern as examples. Reducing overall carbohydrate intake for individuals with diabetes has demonstrated the most evidence for improving glycemia and may be applied to a variety of eating patterns that meet individual needs and preferences, including cultural preferences, including looking at financial needs, ability to prepare meals. So much goes into that. But reducing overall carbohydrate intake can be done, of course, with a low carbohydrate eating pattern, a very low carbohydrate eating pattern, but with other eating patterns as well, considering reduction in carbohydrate. And we also saw in the standard of cares this very important statement: larger sustained weight losses of greater than 10% usually confer greater benefits, including disease-modifying effects and possible remission of type 2 diabetes, and may improve long-term cardiovascular outcomes and mortality. So looking at the issues around weight loss and weight management with all of the information that we are now given and all of the new medications that are coming out, this was an important statement. And looking at that greater than 10% was based on many evidence-based studies.
Thank you so much, Susan. Please click on the next recording within this course to continue with this presentation and the remaining courses from this symposium.